So next we'll be talking about certain superfoods. So I don't really advocate the term superfoods, but still, since it's been used, I'll always use the term as superfoods. So first one here is almonds. So in almonds, when I talk about them, you can see the amount of polyphenols that they have and what are the effects that they actually have on our body. So findings have shown that they help in the growth of short chain fatty acids and help in lowering A1C levels and BMI, but not really significant reduction was seen in postprandial blood glucose or fasting blood glucose. And always we advocate nuts, be it almonds or any nuts, in moderate amounts. And when we talk about fenugreek, which is like the superstar of diabetic treatment, having fenugreek will decrease your A1C level, fasting levels. Yeah, we have good amount of studies to also support them. But how much amount of fenugreek to be taken is also something that we have to take into consideration. We usually suggest around 1 to 2 teaspoons, which is like 5 to 10 grams of fenugreek, and not more than that for consumption on daily basis. So this can be consumed either as in soaked forms, or it can be taken along with foods in food preparations where we use a lot of dals and curries where fenugreek is added as powdered form, or it can be used in as a roasted form along with cumin. So these can be added in the diet, but I wouldn't really say that this is a superfood that will cure diabetes. When we say that a particular food is a superfood, what people do is they just give their full focus on just that one ingredient and leave alone the whole other chunk of having a good, well balanced meal throughout the day. Again, black jeera has a lot of active compounds, especially the terpenoids in them are something that are really beneficial for controlling your hyperglycemic levels. And then cinnamon around 500 grams per day to around 500 milligrams per day to around 1 gram per day have been shown to be effective in decreasing the levels of A1C, even has a better result on insulin resistance and lipid profile. So how can cinnamon be taken? Again, in curries or in the form of cinnamon teas, it can be taken. But whenever you're taking cinnamon tea, make sure that you're not exceeding the amount that has been recommended. Some people end up having 5 to 6 grams of cinnamon powder in a day, which is not really that good for your liver to metabolize all those polyphenols present in them.